It's really been in the last 15 years that total shoulder replacement has come into its own. As we've seen the rise of shoulder arthroplasty, we've now seen patients who need revision shoulder arthroplasty. They need a redo of their joint replacement. It's really been fun to see Ortho Colorado grow. More shoulder replacements are done at Ortho Colorado than any other hospital in the Rocky Mountains. And I'm so proud of the work that we've done at Ortho Colorado to address both primary shoulder problems for patients that have shoulder problems but have never had a shoulder replacement, as well as readdress patients who've maybe had some type of shoulder operation, a partial shoulder replacement, or their own shoulder replacement that didn't go that well. And we now have the type of implants and the type of techniques to address any type of shoulder problem. And we do those on a regular basis. So we can do a partial shoulder replacement, total shoulder, or a reverse total shoulder replacement. We do see people who have fractured their shoulder at a young age, or who have badly damaged the shoulder by dislocating their shoulder. So that type of younger patient who's had some type of trauma to their shoulder, they'll typically feel like they have a very stiff shoulder, or they can't sleep at night, or they can't sleep on their side at night, or they can't reach away from their body. They have a shoulder that doesn't allow them to be very active, or it hampers their ability to work. That's one primary group. Another group of patients are those who have a long-standing rotator cuff tear. And if they have that, they can't really use their arm. They can't lift their arm, and again, they usually have pain on a daily basis. That patient tends to be in their 60s or 70s or even in their 80s, and that pain can be so bad, it can be very life-dominating. Another kind of patient is simply someone who's been very active, or who has bad genetics, or who has rheumatoid arthritis. They have the type of shoulder where it is just worn out over the years. Primary shoulder arthritis, we call that. Most patients within a few weeks say, "I'm better than I've been in years." And we oftentimes hear comments like, "Thank you for giving me my life back." So when we do shoulder replacement, we perform those operations at Ortho Colorado Hospital. Someone's admitted to the hospital typically an hour or two before we do the operation. Most of these shoulder replacement operations last really only an hour or two. You're in the recovery room for about an hour, and then we admit those patients up on our orthopedic floor. The benefit for the patient is that everything has been worked out. We know exactly what type of rehab to provide, what kind of teaching to provide, the right type of immobilization, whether or not to use what type of fancy ice machine. All of that has been worked out so that the patient can have the absolute best care possible.